Dan Williams, Survive Outdoors, Cardiac Coffee Talk today. So, last video I talked briefly about the flying from New York to Denver, then driving to the Rocky Mountains. So here's a scenario. So I'm in Northern Illinois, friend from New York flies into O'Hare, I meet him at O'Hare, we fly from O'Hare to Denver, and we rent a van and we drive up to Rocky Mountain National Park for a 7-day trek in the Rocky Mountains. He is 58 years old, let's say. He has a history of mild hypertension, no other risk factors. We are sitting the first night up by a campfire after we hike at about 8,000 feet, and we hike for, let's say, an hour to an hour and a half, and we're around a campfire. And he brings up to me that he's had some chest pain off and on as he was hiking. And then every time we stopped, it got a little better. And then as we're sitting by the campfire, it's just this feeling that he can't catch his breath. So what could be going on? So we're going to address that issue, but I want to mention that thanks to Richard out there, one of our subscribers, he wrote me and thought this would be a really good topic since he went through an experience like this years ago where he had some chest issues going on. And I thought, yeah, that's a great idea. It's something that's not addressed that often. So, what are the risk factors for cardiac issues? The risk factors for cardiac are obesity, family history of heart disease, being a smoker, high cholesterol. Those are all risk factors. Just being a male over the age of 50 is a risk factor also. So those are all risk factors for having a heart attack. What are the signs and symptoms of a heart attack? Or I should say angina, which is like a precursor. Angina is chest pain. So one of the signs and symptoms that we focus on is clearly the chest pain. It can be anterior chest, it can radiate to your back, it can radiate to your jaw, it can radiate into your neck. It could be either arm. It doesn't have to be the stereotypical left arm. It could be left arm, right arm, shoulders. In women, we very commonly see upper gastric pain above the belly button. That's not unusual. Women can present a little differently. And then if you have these symptoms, you want to look for associated things like, are you sweaty? Are you short of breath? Do you get nauseous when you have the pain? Do you feel like you're going to throw up? Do you throw up? Now, in a clinic scenario, I want to know things like, where is the pain on your body? How long does it last? What is the quality of the pain? Where does it radiate to? Have you had a history of heart issues in the past? So all of these factors are really important in trying to drive what tests we're going to do and what we're going to do. But when you're in the outdoors and you're hiking, your stressors are high altitude, inclines, 20, 30 degree grade, 45 degree grade, climbing up a mountain with 30 pounds on your back. So if you're not in good shape, you're going to have to be very well aware of these signs and symptoms. So the scenario I presented to you, it's very common to have something called a pulmonary embolism, a blood clot in your lungs. So in the mock scenario, this guy had classic scenario of a pulmonary embolism. A long flight, a long drive, not getting out and walking, exercising, all can be some risk factors. And some of the symptoms you'll get with the pulmonary embolism can be a little vague. You can get swelling in one calf, one of your ankles. You could have a DVT. That's a deep vein thrombosis in your calf. And you could also have a PE at the same time. Seen that many times. You can feel short of breath, like you can't catch your breath. Hard to differentiate that when you're at 8,000 feet because, again, there's some overlap. So pulmonary embolism is a differential diagnosis to a heart attack. Is someone having an asthmatic exacerbation? So these are situations that you got to think of. So what do you do? You're 7 miles out there in the outdoors, and you're camping and you're backpacking if you have any of these signs and symptoms. Well, if there's a family history and you feel there's a high risk, well, you need to get the hell out, like now. And take your time. It also depends on the severity of this pain that the person's having. Do they have a family history? Do they have a personal history of heart disease? And you have to weigh all those scenarios. So we're going to talk here about how can you reasonably make a differential diagnosis that it is not heart pain. So I'm not teaching you guys how to diagnose. I'm not going to teach you even treatment. But I do want to mention some real basics, that things that you can do when you're a day, day and a half, 2 days out, besides call for help and evacuate right now. So if you have chest pain, I mean, you're carrying a 30-pound load and you can push on their chest and that hurts, or they move and it makes the pain worse, high probability it's musculoskeletal and not chest pain, not heart attack pain. So that's important to look at. Do they have a history of asthma, COPD? Are they a smoker? Some things could be respiratory. But if you're going to make a mistake and you're going to err, you always should err on the side of evacuating and getting them out. One of the first lines of treatment forever and a day has been aspirin. So on the onset of cardiac pain, and if I know that it is cardiac, that's 481 milligrams of chewable aspirin. It's in my backpack all the time. However, if someone is allergic to aspirin to the point that they have a history of anaphylaxis where they have a severe reaction, don't risk it. That's ridiculous. So you're not sure they have a heart attack. They have a history of anaphylaxis to aspirin. You're going to give them 4 aspirin. You're going to kill them. So no. So don't do that. But if you're reasonably certain and they have a history of heart disease, the person knows their body, so on and so forth, then that would be totally appropriate to do and to get them out as soon as possible, clearly. So in the outdoors, in a survival situation like that, it presents you with all kinds of unique situations, and you're going to have to be creative to evacuate this gentleman or this gal out of there. And it can be really hairy. And the person can have a lot of anxiety, fear, and psychological stress. Really important to reassure them there are many differential diagnoses this could be besides a heart attack. It could be a mild collapsed lung. It could be pleurisy. It could be what we call costochondritis, chest pain, muscular pain, because they're lifting firewood or they're carrying this backpack for a long period of time. So there's all these differential diagnoses. If they have sharp, searing pain, pain that is in their chest that is absolutely on a 1 to 10, a 10, radiating to their back, that could be something called an aortic dissection. And that is evacuate yesterday. That is an emergent situation. Very rare. God forbid you ever come across that. Also, in situations where you may be dehydrated, let's say you're 4 or 5 days prior, you hiked a bunch of miles, you're chopping some firewood, and you're normally going to be fatigued, it's not uncommon to have heart issues present themselves 4 or 5 days later. That's not unusual. It's like the typical back thing. You're chopping wood and you feel pretty good. You go to bed, you wake up the next day or 2 days later and your back is out. What the hell was it? Well, 2 to 3 days ago, you were straining those muscles. So if you get dehydrated, if you deplete a lot of your, your electrolytes, you put your heart in a situation of stress, it may not occur right away and you may start feeling symptoms 3 or 4 days later. That's important to think about. So that we have that in a nutshell. Think about the signs and symptoms of what could be cardiac. And if you're out in the outdoors, it's really helpful sometimes to carry one of those, I know there's a walkie-talkie now that's it's about this big, you can keep on your pack. It's really nice to signal for help. Carry your aspirin. Be aware of what you're looking at. Reassure the person. That's really helpful to calm them down. So that's it in a nutshell, guys. Signs and symptoms of cardiac in the outdoors. Be aware. And have a good Thanksgiving. And hopefully next time it's not snowing. I'm not a big snow fan. My wife loves it. Not me. All right, guys. Keep your eyes on the rise and your face to the wind. Stay safe. Stay healthy. See you next time.